Today we are going to talk about substance use disorder and treatments. What is substance use disorder? Substance use disorder is patterns of maladaptive behaviors and reactions brought about by the repeated use of substances. People with this disorder become mentally or physically dependent on the substance and develop a tolerance for it and experience severe withdrawal symptoms when they don't use it. People with this disorder rely on their drug of choice excessively, which results in damage to their family and social relationships, poor functioning at work, and become a danger to themselves. There is no single cause of substance use disorder. However, some possible influences are family history of drug use, family disruption or a toxic family environment, early childhood loss of a family member or someone close, or personal trauma such as abuse, an accident, a sudden loss of a job, or a sudden loss of a loved one through a breakup or death. Trying to identify if someone has an addiction can be a difficult and sensitive thing, but some possible signs are a decrease in sociability, a lack of control, a dramatic weight loss or gain, telling lies, or stealing money. You can also look for withdrawal symptoms, but these vary depending on the drug. Some common ones are shaking or sweating, mood swings, or an excessive or lack of sleep. It can be harder to tell if a teenager has a substance use disorder. However, adolescents with severe depression tend to already have one, or they are at a higher risk of developing one. The earlier a substance use disorder is identified, the easier it is to successfully undergo treatment. Regardless of which disorder came to fruition first, both should be treated in order to avoid a relapse. The period of adolescence is a vital neurodevelopmental period, meaning the brain is vulnerable to the onset of psychiatric disorders, including depressive and substance use disorders, meaning both need to be treated. There are 4 different approaches when it comes to treating substance use disorder. The first is psychodynamic, then cognitive behavioral, biological, and sociocultural. Each approach can be somewhat effective, however, they are most successful when more than one is used. First, we will talk about the psychodynamic approach. Therapists begin by guiding clients to uncover and work through the underlying needs and conflicts that they believe led to the misuse. The focus is on changing the patient's style of living. This approach works best when combined with another because some disorders, regardless of their cause, eventually become stubborn, independent problems that must be the direct target of treatment. The next approach is cognitive behavioral. With cognitive behavioral, therapists work to identify and change existing behavior and cognitions that contribute to the patient's pattern of misuse. There are 4 different types of interventions that associate with cognitive behavioral: aversion therapy, contingency management, relapse prevention training, and acceptance and commitment therapy. Aversion therapy is based on classical conditioning. This therapy is most commonly used with alcoholism. Clients are first presented with an unpleasant stimulus, which can be a shock or something else, at the very moment they are taking a drug. After repeated pairing, they are expected to react negatively to the substance itself and lose the craving. Next is contingency management. This one is based off of operant conditioning. Patients are offered incentives like cash or privileges that are contingent with the submission of drug-free urine specimens. Both of these are only really effective when the patient is motivated. They must be willing to undergo repeated trials with the unpleasant stimulus and aversion therapy, and with contingency management, they must have motivation to repeatedly come back and give urine specimens. With relapse prevention training, the goal for clients is to gain control over their substance-related behaviors. Clients are taught to identify high-risk situations, appreciate the range of decisions that confront them, change their dysfunctional lifestyles, and learn from their mistakes. A couple of strategies that therapists use that are specific to alcoholism are having clients keep track of when they are drinking and the situation that is around them, teaching their clients to cope with these situations without using alcohol, and then teaching the clients to plan ahead of time when they know they are going to be in a certain situation. This training works best for younger people who do not have the tolerance and withdrawal features of chronic alcohol use. Acceptance and commitment therapy is a mindfulness-based approach. Patients become aware of their streams of thoughts as they are occurring and are to accept thoughts as mere events. By doing this, they are increasing their awareness and acceptance of their drug cravings. By accepting them, clients are expected to be less likely to act upon them. The next approach is the biological approach. The goal of the biological approach is to help patients withdraw, abstain, or maintain their level of use without increasing it. There's 3 different types of intervention with the biological approach: detoxification, antagonist drugs, and drug maintenance therapy. With detoxification, patients gradually withdraw from their substance, taking smaller and smaller doses until they are off the drug entirely. Occasionally, therapists will give patients drugs that will help reduce symptoms of withdrawal, such as anti-nausea medication or anti-anxiety medication. The only downside of detoxification is there's an increased chance of relapse if there isn't a follow-up form of treatment. When using antagonist drugs, patients are prescribed drugs that block or change the effects of the addictive drug. This is most effective with alcohol use and cocaine. An example of this is Narcan, which is an opioid antagonist drug. This drug attaches to endorphin receptors, blocking the effects of opioids. Drug maintenance therapy is typically used with heroin addicts. The addicts are given a substitute or an agonist that allows them to moderate their use in a safe medical environment. This intervention is not ideal because it is basically just substituting one addiction for another. However, one positive aspect is the medical environment helps stop the spread of HIV and HCV that is common among injection drug users. The next approach is sociocultural therapies. This includes self-help and residential treatment programs, which are usually peer support groups. An example of this is Alcoholics Anonymous. There are also culture and gender-sensitive programs. Therapists make a point to be sensitive toward economic status and any abusive environment that may have led the user to use drugs. Another option is online support groups. These are also peer support groups, however they are coordinated through online discussion forums or chat groups. An advantage of online support groups is that they are available 24/7 and they allow for a greater anonymity. They're similar to Alcoholics Anonymous, but you aren't required to follow a 12-step program. Some disadvantages, though, are you're not always going to get a reply, and there is always the chance of trolls or people that aren't taking the online support group seriously. The goal of treatment is for the patient to return to productive functioning within their family, workplace, and environment. The key difference between those who relapse and those who do not is individuals who undergo treatment over extended periods and remain in treatment tend to have more success. Overall, successful treatment for addiction typically requires continuous evaluation and understanding that if a relapse occurs, it does not mean treatment was a complete failure. Rather, it means that the treatment needs to be reinstated or even just adjusted.